Hi, students. We're going to do a quick review of the respiratory system. So, a couple of things. Let's remember that it's in the 3000. We do have the subsections are divided by the anatomy. We also, the example of that would be like all your nose are going to be together, the accessory sinuses, larynx. Then after that, it's going to go into start off with incision of the nose or excision, introduction, endoscopy, repair, destruction. So it's very much goes in that same order for each anatomy site. One thing I have noticed that with the respiratory section, you will notice that a lot of these codes are going to be from the medicine section. So keep that in mind. Um, a good example of that is where we have the spirometry. Okay, we'll get a little bit more into that coming up here in the PowerPoint. But let's just start off here with tracheostomy. So one thing when you do a tracheotomy, make sure you know is a planned, okay? Were they coming in for planned or was it an emergency? What was the approach? Was it transtracheal? Okay, so a couple of different things. And then last one you need to really remember is what is the patient's age? All right, so let's go ahead and move on. Endoscopic procedures. Okay, when you have scopic, keep in mind it's use of the scope. We also have the less invasive, which that's going to be less recovery time, of course. And you want to report the farthest point to which that scope is passed. Okay, so how far did they go with their scope? All right, so let's go. Um, the other thing I want to talk about that real quick. When you do, this just brings in those modifiers. When you do multiple endoscopic surgeries during that same operative session, make sure you're going to list the most resource intensive procedure first, and then any subsequent procedures following, you're going to add that modifier 51 to each. Because remember that that first procedure in a surgery, same surgery session, is going to be at 100%. Then each additional is going to have dash 51. Those are going to be billed in as 50%, and then again 50% decreasing as you go. So a couple of things, don't forget one thing with the 51 is that that is for multiple procedures. Okay. The other thing is with a lot of endoscopic procedures, do not unbundle these. When I'm talking about unbundling, let's say we have a diagnostic endoscopy procedure in the respiratory system. And then under that, indentation in the CPT book, we have excision of or repair of the sinus. Okay. So you're only going to use one code because that repair of the sinus is going to include the diagnostic portion of that. So if you would code both at that point, it would be unbundling. So again, you just want to code that one procedure. Okay, then we get into the thoracentesis. A lot of times this could be because a patient has pneumonia. What it is, you're withdrawing fluid from the pleural space. It could be done for, as I stated, pneumonia, congestive heart failure, and that drainage tube can be left in place. So you do not report that separately. It's included in the thoracentesis itself. Okay, as I stated before, there is quite a few medicine section codes. The 9000s, remember, those are going to be medicine. We have spirometry, aerosol inhalation. These are examples. I always kind of like to say that the medicine section usually diagnostic, but there can be therapeutic codes also in the medicine section. Okay, so the first one they kind of talk about here is the spirometry. This measures the breathing capacity. It can be used for therapy. It just kind of gives you the codes here. And then we have just different types: force, vital capacity. I won't go too much into them. All right, so complete spirometry. With that, we have 94010. This measures the inhalation and exhalation, exposure to irritants. We have the other thing going on here, bronchospasm. Okay, so a good example of that would be asthma. Provoked bronchospasms by administration of agent. They've given you a histamine. So a couple of different things, measurements of changes of breathing capacities. One thing I do kind of want to talk about from your book, a lot of these codes are going to be the total component. Okay, so what I mean by that, that the respiratory or the pulmonologist does the procedure, which would be the technical component, and then reads their own report, which is the professional component. So a lot of these, you don't have to put a TC or 26 on unless they absolutely state they only do the professional component or the technical component. Okay, so these here are just some 9,000 codes you can review. Not going to go too much into that. It just kind of explains each code. The other thing here, sleep studies. So any CPAP, they're going to be in the 9,000 section. Keep that in mind. CPT index. When you look in the back of your CPT book, the big thing that you're going to look under is pulmonary. Okay. Then you want to distinguish between, was it diagnostic, was it therapeutic? So the respiratory section isn't too bad. Um, Go ahead if you have any questions, please reach out and let me know. I'll be happy to answer them.